This chapter brings us to the certification of malaria elimination.
By the end of this section, you should be able to understand the criteria for certification of malaria elimination by WHO, describe the procedures for certification, describe the subnational verification process and how it is similar to and different from the WHO certification process, summarize the requirements of countries after certification. Before we begin, this is just a quick review of some key terms we saw in Unit 1. Elimination refers to the interruption of indigenous transmission of specific species of malaria in a defined geographical area. Although elimination can technically refer to an area of any size, for the purpose of certification, it applies to the entire territory of a country. Certification is the official recognition of a country's elimination of all human malaria species. WHO grants this certification after a careful review of evidence that a country has successfully interrupted transmission of all human malaria parasites and has a program in place to prevent re-establishment. Certification is a voluntary process. Countries must decide to request WHO certification. There is no requirement for countries to be certified, although it is strongly recommended. Re-establishment of transmission means that an area that was previously malaria-free has renewed malaria transmission. Re-establishment could happen at any time after elimination of malaria. If countries do not have an adequate program to prevent re-establishment, are not careful to investigate all imported cases, and do not maintain vector control interventions in areas with competent and abundant vectors and risk of importation. Now that these terms are clear, let's move on to discuss certification.
Malaria elimination in a country is a significant public health achievement requiring decades of commitment and effort. WHO certification of malaria elimination is the official recognition of this public health achievement. Certification is also an important acknowledgement of the hard work and sacrifices of the health workers during the decades they spent battling the disease. Certification recognizes the significant political support and resources that the government has committed to improving the health of its population. Certification also represents a global milestone towards the vision of a world free of malaria. Certifications are always celebrated by the international community as a sign of progress towards ridding the world of one of the oldest diseases to affect humans. Certification helps motivate other malaria endemic countries to set elimination as their goal. Certifications also have an important effect on keeping malaria high on the political agenda. In preparing for the certification process, countries generally must strengthen their program to prevent re-establishment, and thus certification can help accelerate those improvements. Additionally, the independent experts involved in certification will review and evaluate a country's program to prevent re-establishment, thereby identifying weaknesses and gaps that can be adjusted. Although a country decides whether or not to request certification, it is for all of these reasons that WHO strongly encourages countries to do so. In this unit, we will review the history of certification, learn about the criteria, review the process, and get familiar with the records and documents required. Soon after the Global Malaria Eradication Program was launched in 1955 to rid the world of malaria, the 13th World Health Assembly requested WHO in 1960 to establish an official register listing areas where malaria eradication is achieved after inspection and certification by a WHO evaluation team. Note at that time, The word eradication was used in the same way that we use elimination today, applying to a single country rather than the globe. The official register of certified countries permitted the checking of countries where malaria was no longer transmitted and the risk of getting infected was negligible. For countries to be entered into the official register, they had to be inspected and certified by a WHO evaluation team. We now refer to this as the certification process. WHO is advised on the certification process and on recommendations for certification by the independent external Malaria Elimination Certification Panel. The register is now available online. This is an overview of countries and territories certified by WHO. Between 1955 and 2021, 40 countries and territories were certified as malaria-free and entered in the WHO official register. Reference is made to the official names of WHO member states as of February 2019. For example, the former Yugoslavia was certified in 1973, and the member states created following its breakup have inherited its certification status. No countries were certified between 1988 and 2006, as the certification process was discontinued. Part of the reasons is because after the Global Malaria Eradication Program, the global malaria strategy had shifted its focus to control rather than elimination.
There are two criteria for WHO certification of malaria elimination. First, the local malaria transmission has been fully interrupted, resulting in zero indigenous human malaria cases for at least the previous 3 consecutive years. And second, that an adequate program for preventing the re-establishment of indigenous transmission is functional throughout the country. In Module 7, we review the requirements for a program to prevent re-establishment. It is interesting to know that only the first criterion was required for certification during the 1960s. The second criterion was added after 1973. As elimination programs entered the consolidation phase, some areas experienced resurgence in the 1960s and 1970s, which led to the recognition of the importance of maintaining an adequate general health service to sustain a country's malaria-free status. The process of certification involves an independent expert panel that reviews evidence and concludes whether or not both of these criteria have been met. The certification process is structured, formalized, and documented. The process follows rigorous standards to ensure that only countries that have achieved elimination and are currently capable of preventing re-establishment are certified. The process itself starts once a country has achieved at least 3 consecutive years or 36 months with no indigenous cases of malaria. However, countries can begin preparing for certification in advance to help them move more quickly through the process. We will touch on how countries can better prepare later in this module. The country sends an official request to WHO for certification. The country can make its request at any time from the 37th month that it is free of indigenous malaria cases. It is not required for the country to have already finalized its national elimination report when it requests certification. With WHO's support, a country will assess its readiness for certification, develop a plan of action to address gaps in its preparations, and develop a timeline to complete any required tasks in time to receive the independent evaluation mission. When the National Elimination Report is finalized, it is translated into English if needed and sent to WHO for final review before being sent to the Malaria Elimination Certification Panel, or MECP. A subgroup of the MECP undertakes an in-country certification evaluation mission to validate the findings reported in the National Elimination Report. This independent evaluation mission must be allowed to visit any part of the country and examine all records and documents needed to verify that the two criteria for certification have been met. After the mission has been completed, the full MECP meets to review the National Elimination Report and the findings of the independent evaluation mission. They recommend whether certification should be granted or certification should be postponed. The recommendation of the MECP is reviewed by WHO's highest committee on malaria, the Malaria Policy Advisory Group. They ensure that the certification process has been carried out appropriately and endorse the recommendation to the Director General of WHO. Finally, the Director General takes the final decision to certify the country as malaria-free, considering the findings and recommendations from the two committees. The MECP provides an independent expert view on whether a country has proven beyond a reasonable doubt that it has interrupted indigenous malaria transmission and has adequate capacity to prevent re-establishment of transmission. The MECP is composed of senior malariologists and advise WHO on the certification process and standards. The MECP conducts an independent evaluation mission to a country requesting certification to determine whether the two criteria have been met. Ultimately, the MECP recommends to the Director General whether a country should be certified or certification should be postponed. To determine beyond a reasonable doubt whether the country has fully interrupted local malaria transmission, the MECP considers two questions. First, whether the activities reported by the country were sufficient to have resulted in elimination. And second, whether the coverage and quality of the surveillance system in all geographical areas of the country, particularly over the past 36 months with 0 indigenous cases, was sufficient to have identified an indigenous malaria case if there had been one. To evaluate the adequacy of a country's program to prevent re-establishment of malaria transmission, the MECP examines the strategies, technical soundness, and comprehensiveness of the activities in the program to prevent re-establishment, quality and coverage of malaria surveillance and response, quality and coverage of diagnosis and treatment, capacity for entomological surveillance and vector control, and sustainability of financial and human resources. To arrive at its conclusions and recommendations, the MECP will review and evaluate information from a variety of sources. The first information source is the National Elimination Report that a country prepares using a template provided by WHO. This report provides a history of malaria in the country and strategies and actions that the country has taken to achieve elimination. The country is asked to report detailed information on the characteristics of malaria cases and vectors over time, along with complete descriptions of the country's past and current strategies for case management, surveillance, and vector control. The report includes factors that could help to evaluate the adequacy and sustainability of the components of the program to prevent re-establishment, including the financing for malaria activities. The MECP may also review published and unpublished articles and reports about the country's malaria and operational research history. The MECP will review the country's plan to prevent re-establishment. The plan should include a risk stratification map showing where the country is receptive to transmission and has a risk of importation, and the approved budget for implementation. During the independent evaluation mission, the subset of MECP members who travel to the country will attempt to validate the data in the National Elimination Report by comparing the information in the report with the documents and records found in the country. The MECP members of the Independent Evaluation Mission will write a report of their evaluation, and this report will be reviewed by the full panel to make their final conclusions and recommendations.
Now that we have an understanding of what the criteria are for certification and the type of evidence the MECP uses to judge whether the criteria have been met, let's consider how programs can begin planning for certification. The first step for programs starts well before they interrupt transmission because they need to begin keeping and organizing documents and records that will be used later for certification. Public health programs, such as malaria programs, routinely develop documents that describe how things should be done and records of what is actually being done. Both documents and records should be retained by malaria programs for use in monitoring and evaluation, as well as to provide accountability to the public for the actions taken to protect their health. However, not all programs are equally good at retaining and organizing their documents and records. Because certification depends on demonstrating key evidence to the MECP, countries with elimination goals should begin immediately to improve their document and record keeping at subnational and national levels in order to facilitate their own monitoring and evaluation, as well as the certification process. The manual preparing for certification of malaria elimination includes a detailed list of the different kinds of documents required for certification and the period of time they should cover. We won't cover everything required in detail, but we'll just review some of the key documents and records needed for the certification process. Strategic and operational plans, guidelines, and standard operating procedures should be available as they help explain the strategies and activities the country undertook to achieve elimination. These documents may be reviewed by the MECP to determine whether the activities were implemented consistently and accurately. This slide shows some of the documents used in countries recently certified. The current versions of these plans, guidelines, and manuals should be available to everyone who plays a role in these strategies or activities. In other words, copies should be found with staff or offices at all levels. Documents must be updated regularly when there is a change in strategy or plans or improvements to guidelines or procedures. Here are some examples of laboratory logbooks and documents on external quality control from two countries recently certified. Records are created in the course of performing, reporting, or evaluating activities. They may be handwritten or digital. Records may serve to document the results of patient encounters, training sections, or cross-checking of blood slides. Records demonstrate what has been done and thus are essential to understanding what has been implemented by the program. There is an old adage that says, if it's not written down, it didn't happen. This also applies to certification. There must be proof of what the program says it did.
We mentioned how important it is for records to be available for the MECP to review in order for it to understand what the National Malaria Program did to achieve elimination and how well it did it. Records can also help with the second criteria, that is, demonstrating that there is an adequate program in place to prevent re-establishment. Separate into groups of 5 to 6. Each group will be assigned to Criterion 1 or Criterion 2. List as many records and documents that you think the program should have available as evidence for the criterion you are covering. Be prepared to report back to the plenary.
Now we are going to go into a little more detail on two of the key records that will be reviewed by the MECP. The Malaria Case Register or Case Database is one of the most important records for certification. Countries should have a malaria case database that records at least the minimum data listed on the slide for each malaria case. The justification of the case classification is critical and should be documented in the database by recording the location of the patient during the likely infection period. In addition, the original case investigation forms for each case must be available whether the original was on paper or digitized. Data entered into the case database should be checked regularly and compared with subnational records to ensure concordance. Cases detected in one jurisdiction that were infected in a second jurisdiction should be recorded in both jurisdictions, and the database should be able to distinguish these cases that were internally imported or transported. The focus register is also an important record because it documents the specific actions taken to interrupt transmission in each focus. A focus register is like a case database in a sense that each line in the register corresponds to a specific focus. The focus register should be updated each time there is activity in the focus or the focus is investigated. On an annual basis, the status of each focus should be evaluated and the classification updated if appropriate. The focus register is an important management tool to ensure that no area is forgotten and that each focus is accounted for. The MECP will likely review the focus register and triangulate those data with the information included in the National Elimination Report. The table provides an example of a plan of action for certification with a timeline. The time that will be taken for each step is indicated. Once a country submits a final version of the National Elimination Report, it generally takes 4 months to complete the whole process. The length of time between an official request for certification from a country and the submission of the National Elimination Report varies significantly among countries and depends on whether they have been preparing their report over time. Of all the activities in the certification process, the independent evaluation mission is the most critical. The length of the mission depends on the size of the country. The dates for the mission will be agreed upon between the government and WHO in advance. Just a few more points before we close. Similar to national certification, subnational verification of malaria elimination is a process that some larger countries may undertake to recognize interruption of local transmission in certain parts of their country. Neither WHO nor the MECP evaluates elimination in subnational areas, but WHO recommends that countries consider this approach for several reasons. First, creating friendly competition among subnational areas to see which can eliminate first could motivate areas towards a positive outcome. Once subnational elimination has been achieved and verified, political leaders and Ministry of Health personnel may be loath to lose their status and so contribute more eagerly to the program to prevent re-establishment. Subnational elimination reinforces national commitment and advocacy for elimination countrywide. Second, in large countries, completing subnational verification in a standardized and rigorous manner can ease the certification process, allowing certification to happen more quickly and easily. In such cases, using the WHO certification guidelines as the basis for subnational elimination will contribute to the rigor of the process. Subnational verification can be a powerful approach to accelerate towards elimination because it not only contributes directly to strengthening elimination programs but also demonstrates progress towards achievement of a national goal. This in turn reinforces the national commitment to achieving elimination and helps advocate for continued or additional funding. Hopefully, it is not a surprise that even after certification, the country must continue its efforts to prevent, detect, and respond to malaria until global malaria eradication is achieved. No country is safe from re establishment until the world is free of malaria. We've already reviewed what this will take in Unit 7 on prevention of re establishment. And do not worry, WHO will still be there to support countries that have achieved elimination at the same time as the organization works to achieve a malaria free world. To ensure that WHO is notified early of any potential re establishment of transmission, countries that have been certified as malaria free by WHO should continue to report to WHO annually through the World Malaria Report. Here are the elements to be included in the annual reporting. Confirm malaria cases detected in a country during the reporting period by species, case classification, and origin. Brief histories of all reported introduced or indigenous cases, if any, and brief histories of all reported malaria deaths and other unusual events, including cases of congenital malaria and induced malaria. This information permits WHO to report back to the World Health Assembly on one of the goals of the Global Technical Strategy for Malaria 2016 to 2030, that is, the prevention of re-establishment of malaria in all formerly endemic countries. It also enables WHO to quickly assist countries that show evidence of reintroduction of malaria to prevent re-establishment. Finally, certification of malaria elimination can be lost should malaria transmission be re-established. The minimum indication of possible re-establishment of transmission is the occurrence of 3 or more indigenous malaria cases of the same species per year in the same focus for 3 consecutive years. A careful national investigation and consultation with WHO would be required before revoking a country's malaria-free certification. It's important to realize that, to date, no country has ever lost its WHO certification of malaria elimination.
The following slides review the documents and records that may be reviewed by the MECP when conducting the independent evaluation mission. We will review the slides, and after each slide, I will ask you the following questions. Does your country or area have the documentation and records required for certification? What records need to be kept that are not being kept now? Which documents or records are incomplete?
This graphic shows the reference timeline to help interpret the periods to be covered by documents and records requested for certification. We start at time point 0, which is the day of the last indigenous case of malaria. Of course, this can really only be known in retrospect after the country has achieved the full 3 years of 0 indigenous cases, but is useful as a theoretical reference point. The period to be covered by documents and records are referred to by negative numbers if the period was before the last case and positive numbers if after the last case. For example, -9 means 9 years before the last indigenous case, and at 3 years after the last indigenous case, a country would be eligible for certification. Plans, reports, and legislation. Does your country or area have the documentation and records required for certification? What records need to be kept that are not being kept now? Which documents or records are incomplete? Surveillance. Does your country or area have the documentation and records required for certification? What records need to be kept that are not being kept now? Which documents or records are incomplete? Diagnosis. Does your country or area have the documentation and records required for certification? What records need to be kept that are not being kept now? Which documents or records are incomplete? Case management. Does your country or area have the documentation and records required for certification? What records need to be kept that are not being kept now? Which documents or records are incomplete? Vector control. Does your country or area have the documentation and records required for certification? What records need to be kept that are not being kept now? Which documents or records are incomplete? Additional reports. Does your country or area have the documentation and records required for certification? Which records need to be kept that are not being kept now? Which documents or records are incomplete?
In sum, 1. Certification of malaria elimination requires proof that local malaria transmission has been fully interrupted and the country can prevent re-establishment. 2. Certification is voluntary and must be requested by member states. The process can take many months depending on several factors. 3. Subnational verification is optional but can contribute building political will for elimination. 4. After certification, countries must continue to prevent malaria transmission and report any cases to WHO annually.